Hey everyone, this is Dr. Carl Youssef. I'm a board-certified emergency doctor. Today, I'm going to talk to you about one of the top, scariest cases that I've had in the emergency department. From babies not breathing to a man's face and mouth swelling so much that it would suffocate him, and even a man's scalp being ripped off of his head. These are real and very scary cases I've had that have made my heart pound in my chest.
My finger has a heartbeat.
I'll take you through exactly what happened and how I handled it. Some details are changed to protect patient identity. I'm called on our overhead pager emergently to a room called Trauma Peds. You never know what you're gonna find when you're paged overhead, so I always run. I get there and I see this 3.5-year-old baby girl gasping for air. This is not typical, so I quickly ask the mom what's her story. She tells me that her daughter has renal failure. We see this a lot in adults, but it's incredibly rare in children. Unfortunately, this little girl had something called nephritis and her kidneys were failing. That means that she can't urinate and water can fill up dangerously in her body. I immediately listened to her lungs and she had the classic sound of crackles. That's when the lungs are full of fluid. Like a flooded road that stops traffic, oxygen can't go in or out of the lungs. Sometimes we can give medications and put positive airway pressure to try forcing fluid out of the lungs. But I looked at her and she was getting way too tired. She was panting, having retractions, and couldn't even stay awake anymore. This is very scary. She was using all of the muscles in her little body to try to breathe, and I didn't think she had much left to go before she fully stopped breathing. This is always a tough decision for an emergency room doctor, but I knew we had to sedate her and put a tube in her lungs to help her breathe. This is always dangerous on its own, so we got our medications ready, tube ready, nurses ready, and they asked me, should we give the meds? To be honest, after many years, there isn't much that gets my heart rate up in the emergency department, but for some reason, I could just hear my heart beating in my ears. I just tried to rely on my usual procedures. I let the nurses know we can push the sedating and paralytic agents, and they did, and she stopped breathing.
Oh God.
But that's supposed to actually happen. I had a limited time. I grabbed what's called a CMAC blade and carefully tried to find her vocal cords. Now, this isn't a real blade, it's just a tool that we use when we're intubating. Children are always tricky and can be difficult to intubate. Luckily, I found her vocal cords and knew that I had a brief chance to pass the tube. My team immediately handed me the tube. It was placed between her vocal cords and we quickly listened to make sure she had good lung sounds. Finally, I could take a breath of relief and feel the weight of the situation. She actually did well. We were able to oxygenate her and wow, that was scary. This honestly was nearly as bad as the time that I saw a 55-year-old man who told me his lips and tongue felt swollen. Click on the video in the link above to hear that story and subscribe so you don't miss out on any of these insane medical explanations.